Assalamualaikum warahmatullahi wabarakatuh. Welcome to Iranon District Hospital Performance Implementation Review 2024, spearheaded by Dr. Haris MACAPEGES, Chief of Hospital 2. In this presentation, we will be sharing to you the latest updates and performance highlights of Iranon District Hospital, and we will also be presenting key hospital statistics, achievements, and developments that reflect our continuous commitment to delivering quality healthcare services to our community. Iranon District Hospital is a government-owned healthcare facility. It is officially designated as a district hospital located at Notre Dame Site, Poblacion 1, Parang, Maguindanao del Norte. Iranon District Hospital is classified as an infirmary with an active delivery room, enabling us to cater to both outpatient and maternity services. We are equipped with Level 2 laboratory, providing essential diagnostic services to our patients. We have 25 authorized bed capacity and a total of 50 implementing beds to meet the demand of the population we serve. We serve an estimated population of 364,002 people across the area. Iranon District Hospital holds multiple accreditation and membership, including PHIC accreditation, Consulta accreditation, and recognized as a newborn screening facility. Additionally, it is a licensed by the Department of Health and proud member of PHA. Iranon District Hospital offers a wide range of essential medical and public health services to meet the needs of our community. This includes outpatient department services for regular consultation and follow-ups, emergency room services providing immediate care for urgent and life-threatening conditions, laboratory services, pharmacy services, family planning services to support reproductive health and responsible parenthood. We also have newborn screening services, ultrasound services, dietary services for nutritional assessment and diet planning for patients. We also have delivery room services, operating room for minor surgical procedures, maternal and child care services. We also have Women and Children Protection Unit providing assistance to victims of abuse and violence. We also have Adolescent and Youth Development Program promoting the health and well-being of our young people in the community. At Iranon District Hospital, we go beyond clinical care by offering comprehensive support services and specialized programs that cater on the diverse needs of our patients and community. That includes ambulance call or transport services, social worker services or the B-Cares, MAIPP or the Medical Assistance for Indigent Patients Program, AMBAG, the Ayudang Medical mula sa Bangsamoro Government, PhilHealth, Consulta. We also have mental health and psychosocial support, Women and Children Protection Unit, and the Animal Bite Treatment Center. Iranon District Hospital led by Dr. Haris MACAPEGES, who served as the Chief of Hospital 2, overseeing the overall operations and administration. Supporting him is Dr. Norhaina Sinarimbo as the Chief of Clinics, manages the clinical services and ensuring the quality care provided. Reham O. Dimaran RN Man, the Chief Nurse, responsible for nursing services and patient care. The administrative function managed by Catalino O. Molina Jr. RN Man. The Administrative Officer 5 plays a vital role in maintaining the hospital's internal operations and ensuring the frontline healthcare providers are well supported. This structure ensures that the hospital functions efficiently with clear roles and responsibilities across both clinical and non-clinical departments. Iranon District Hospital authorized bed capacity remained consistent at 25 beds from 2022 to 2024, in compliance with the Department of Health licensing regulations. However, the implementing bed has steadily increased from 35 beds in 2022 to 45 beds in 2023 and reaching 50 beds in 2024. This reflects the hospital's growing commitment to meeting patient demand even beyond its authorized limit, ensuring no patient is left unattended despite infrastructural limitations. The progressive increase highlights both the hospital's operational expansion and the growing healthcare needs of the surrounding communities. The bar graph illustrates the annual bed occupancy rates of Iranon District Hospital over a 3-year span. In 2022, The occupancy rate was 76.2%, indicating a manageable patient load relative to available beds. The rate sharply increased to 102% in year 2023, and the rate further escalated to 154% in the year 2024. This indicates that more patients are seeking care at Iranon District Hospital. Iranon District Hospital received a total of 1,570 admissions in year 2022. These admissions increased dramatically in year 2023 with a total of 2,154 admissions and a total of 3,071 admissions in year 2024. The increase in admissions indicate that the community has growing trust in the hospital services and quality of care. In 2022, IDH did not receive any referral from other healthcare facility for inpatient care, and this changed in year 2023 when the hospital received a total of 25 patients from other facilities, indicating growing recognition of its capabilities. In the year 2024, the number of transfers increased to 141 patients. This dramatically increased in patient transferred indicated that the hospital's critical role in providing quality care in the community. Increased referrals indicates reputation and trust from other nearby facilities. In 2022, IDH transferred a total of 57 inpatients to other facilities. This number increased to 70 in 2023, and by 2024, a total of 121 inpatients had been transferred to other facilities. This indicates that there is an increase in complex or high-risk cases that required specialized care or advanced technology. This also indicates limited availability of specialized services or expertise, insufficient equipment and resources, and increased volume of critically ill patients. The hospital's outpatient department served a total of 2,957 patients in year 2022. In 2023, this number increased significantly to 4,166 patients. In year 2024, a significant jump was observed, with 13,887 patients served, more than triple in the year 2023. The rise of OPD indicates growing community trust in the hospital services and quality care, expanded services and specialties like the opening of ABTC program. This also indicates increased satisfaction with the care they received. In IDH, the total number of emergency department visits increased from 962 in year 2022 to 2,223 in year 2023. This upward trend reflects a growing demand for emergency services. By 2024, the number of visits further escalated to 5,483, showing a continuing upward trend. The increase of ER visits is a sign that the hospital has expanded its services and specialties, improved community outreach and education, indicates growing recognition of hospital's expertise in emergency case, and suggests that the hospital is providing a positive patient experience, leading to more patients choosing the hospital for their emergency care needs. In IDH, the total number of patients transferred from emergency room department to other healthcare facility have shown a positive upward trend in 2022. A total of 91 patients, and this increases to 193 patients in year 2023, indicating successful coordination and referral processes in year 2024. The number of transferred increased to 1,334 patients. This slide shows the top 10 leading causes of morbidity from year 2022 to 2024 based on hospital records. It helps us to understand the most common health conditions affecting our population over the past 3 years. Pediatric community-acquired pneumonia or community-acquired pneumonia moderate risk has remained the leading cause of morbidity in both 2023 to 2024 and ranked second in 2022, showing its ongoing public health impact. Similarly, acute gastroenteritis with moderate dehydration and urinary tract infection have consistently been in the top 3 causes each year. Dengue fever with warning sign rose from 8th spot in 2022 to 4th place in 2024, suggesting an increase in mosquito-borne disease cases. Acute gastritis, which ranked 4th in 2022, dropped off the top 10 in 2024, possibly indicating improved dietary habits or treatment protocols. While some causes of morbidity have remained consistent, shifts in ranking and emergence of new conditions suggest changing health patterns that warrant further investigation and targeted interventions. IDH Top 10 Leading Cause of OPD Consultation. This table shows the top 10 most common reasons for outpatient department consultations at our hospital over the past 3 years. Urinary tract infection and acute gastritis have consistently remained the top 2 leading causes of OPD visits for all 3 years, indicating ongoing community health issues that need targeted intervention and health education. Respiratory illnesses like upper and lower respiratory tract infections and pneumonia continue to be prevalent, reflecting seasonal and environmental health challenges. We observed the emergence of diabetes mellitus type 2 and hypertension stage 2, especially in 2023 and 2024, which shows a growing burden of non-communicable diseases. In 2024, new entries such as punctured wound secondary to animal bite, dorsal slit incision, and community-acquired pneumonia or pediatric community-acquired pneumonia moderate risk reflect possibly changing service focus or new community needs being addressed. Infectious diseases like dengue, pulmonary tuberculosis, and febrile convulsions also appear across the years, showing the need for continued disease surveillance and community prevention programs. Overall, these trends help us understand the evolving health profile of our patients, prioritize resources, and plan more responsive health interventions. These slides shows the top causes of mortality recorded in our hospital from 2022 to 2024. It provides insight into the most critical health issues our patients face and helps us identify areas for focused intervention and improvement. In 2023, dengue hemorrhagic shock became the leading cause of death, which emphasizes the importance of dengue prevention and early management. Other causes included pediatric community-acquired pneumonia with hypoxia and malnutrition, and complex cases of pneumonia and possible cerebrovascular involvement. In 2024, pediatric and high-risk community-acquired pneumonia remained the top causes, along with sepsis and electrolyte imbalance related to dehydration. Other complex cases included cardiogenic shock, asphyxia, and complications from chronic infections like pulmonary tuberculosis. The patterns across the year shows the respiratory illnesses, severe infections, cardiac issues, and dehydration-related complications continued to be significant threats to patient survival. These statistics highlight the need for early detection, timely referral, and improved critical care capabilities. This graph shows the yearly volume of laboratory tests conducted at our hospital from 2022 to 2024, categorized by test type. Urinalysis saw a significant rise from 3,592 in 2023 to 9,271 in 2024, indicating either an increase in urinary-related cases or better compliance with diagnostic protocols. Fecalysis remained consistent across the years, with a slight increase showing a steady use for gastrointestinal symptom investigation. Hematology experienced a dramatic growth from 2,282 in 2023 to 14,810 in 2024. This increase suggests either more routine monitoring, a rise in anemia or blood-related conditions, or a broader testing policy. Clinical chemistry jumped from only 183 in 2023 to 7,812 in 2024, showing a massive expansion in diagnostic capacity, possibly due to improved lab capabilities or an increase in chronic illness monitoring, like blood glucose, liver, or kidney function. Serology also grew steadily, reaching 2,418 in 2024, which may reflect increased testing for infections and immune-related concerns. The upward trend in all categories reflects both increased patient volume and improved utilization of laboratory services. It highlights the hospital's ongoing commitment to better diagnostics, early detection, and evidence-based care. In 2022, we were able to perform 962 X-rays on-site during the first half of the year using our portable X-ray machine. However, the machine suffered damage by mid-2022, limiting our capacity to conduct X-rays internally. As a result, 321 patients had to be referred to other facilities for imaging. By 2023, with no functional X-ray equipment, the number of on-site X-rays dropped to 0, and referrals significantly increased to 1,085 cases. In 2024, due to the continued lack of in-house X-ray capabilities, the referrals peaked at 2,987, which reflects the growing patient load and the need for imaging services. This trend highlights the urgent need of X-ray machine to reduce referrals, improving diagnostic efficiency, and provide timely care within our facility. These slides shows the ultrasound services from 2022 to 2024 showing both performed and referred procedures. In 2022, we conducted 691 ultrasounds on-site with 128 referrals. Despite the limitations, services were consistently provided. By 2023, the number of performed ultrasounds slightly decreased to 530, while referrals more than doubled to 278. This reflects an increase in patient demand compounded by the limited availability of ultrasound services. In 2024, we recorded 681 ultrasounds performed, but referrals sharply rose to 1,003. This significant increase is primarily due to the limited availability of the sonologist, who is on a scheduled duty basis only. The current setup does not meet the growing demand, especially during emergencies or peak OPD days. This trend underlines the need for a full-time or more frequently available sonologist to reduce patient referrals and enhance diagnostic support within the hospital. IDH total number of surgical operations from 2022 to 2024. In 2022, there were only 122 operations conducted, mostly minor or scheduled cases. In 2023, the number significantly rose to 1,588, reflecting improved surgical services and patient access. By 2024, the number surged to 5,675 operations. This dramatic increase can be attributed to two key factors. First is the inclusion of tooling procedures performed during medical missions and outreach programs. Second is the appointment of a surgeon as our chief of hospital, which played a major role in expanding surgical capabilities and prioritizing operative cases in the hospital services. These developments have greatly enhanced the hospital's ability to respond to surgical needs, particularly in remote and underserved communities. IDH Pharmacy Department. This chart shows the total number of patients served by the pharmacy department from 2022 to 2024, broken down into inpatient and outpatient services. In 2022, the pharmacy served 530 inpatients and 1,288 outpatients. In 2023, both figures increased to 2,154 inpatients and 2,623 outpatients, reflecting improved hospital utilizations and increased access to pharmacy services. By 2024, there was a significant rise in service coverage with 3,071 inpatients and a sharp increase to 9,087 outpatients. This steady growth highlights the expanding reach and efficiency of our pharmacy department. The surge in outpatient numbers in 2024 in particular can be attributed to better access to medications, increased community awareness, and the hospital's broader service offering, including more frequent consultations and follow-ups. Iranon District Hospital good practices that have helped our team work more efficiently, improve collaboration, and deliver better results. These are simple yet powerful actions that, when done consistently, can make a big difference in our daily operations and team culture. Training of staff to treat patient care as their top priority. By consistently conducting this training, we ensure that our personnel are not just technically capable, but also compassionate and patient-centered in their approach. Exceptional coordination with stakeholders. This good practice strengthens partnership and leads to more responsive and efficient healthcare. Continuous establishment of building for expansion and optimize efficiency and functionality. This is essential to meet the growing demands of healthcare services. Monthly conduct of health program celebration. Consistently celebrating health program also helps reinforce key messages and fosters a culture of health within the facility. Case presentations are being conducted to formulate and update CPG. This is to enhance clinical learning and decision making. Re-echo of trainings to all health and allied personnel. This is valuable knowledge and skills gained by a few and are shared with the entire team. Another good practices is the constantly asking the team involved for feedback on how to improve operations. This approach helps us continuously improve our operations by identifying gaps, optimizing workflow, and fostering a culture of open communication. Good IT support for efficient, productive workflow. This is crucial in maintaining smooth and secure operations, especially in healthcare settings where timely access to information can impact patient care. Team building in coordination with CSC. This is essential for creating strong, united team that works well together. Active Health Education and Promotion Officer. Daily conduct of health updates to patients and hospital personnel. Active Health Education and Promotion Officer. Daily conduct of health updates to patients and hospital personnel. Weekly conduct of flag ceremony and flag retreat. Monthly, semi-annual and annual performance evaluation. This is essential in monitoring progress, identifying strengths, and addressing areas of improvements. Set goals and map out plan to reach them. It helps everyone understands what needs to be achieved and creates motivation to work toward those objectives. Recognizes and reward performance. This is a powerful way to motivate employees and show them that their hard work is valued. Conduct of regular monthly meeting. This good practice is important to raise all the issues and concerns in the unit to deliver quality health care to patients. Detailed roadmap and project plan. These are essential for the success of any initiative. Scientific meeting. Play a crucial role in promoting continuous learning and professional development. Health team support during medical mission. This is vital to ensure smooth operations and quality care. Updated manual of procedures. This is to ensure consistency, efficiency, and safety in daily operations. Regularly provide tools and frequent coaching. Equipping staff with the right tools and providing frequent coaching are key to maintain high performance and quality service. Standardize care through the use of clinical pathway guidelines. This good practice helps ensure the patient care is consistent, evidence-based, and efficient. Optimize hospital workflow. Efficient hospital workflow is critical to delivering high-quality patient care. A well-structured workflow ensures that every process from patient admission to diagnosis, treatment, and discharge runs smoothly. Iranon District Hospital identified challenges, issues, and concerns. Infrastructure strain. There is a pressing need to expand or possibly relocate facilities, but we must do this without interrupting ongoing services. Staffing issues. We are having difficulty recruiting permanent doctors, which affects service delivery and continuity of care. Challenge in water and electricity. Unreliable access to water and electricity disrupts operations and patient care. Training needs. As we transition to a more complex Level 2 facility, our staff require additional training to meet the new demands. Resource limitations. We're facing shortages in both equipment and medical supplies, which limits the quality and scope of care. Financial constraints. There is a gap between our allocated budget for 25 beds and our actual implementation serving 50 beds, making it difficult to meet operational needs. Patient overload and increased referrals. Our facility is experiencing a growing number of patients, leading to overcrowding and strain on our services. This also results in more patient referrals to other facilities, which can delay care and put additional pressure on the healthcare system. And lastly is the waste management. IDH is facing difficulties in the proper handling and disposal of toxic and infectious waste. This is a major concern not only for environmental safety but also for the health of our staff and patients. Strengthening waste segregation, collection, and disposable processes is essential to ensure compliance with health standards. IDH Ways Forward or next steps. Expand physical facilities to match patient volume growth. Hire qualified medical and support staff aligned with expansion plans. Provide continuous training and professional development. Strengthen community and stakeholder engagement. Telemedicine and remote monitoring. Upgrade medical equipment and technology. Community engagement and outreach. Enhance quality assurance and accreditation. Increase service capability like active operating room that can perform major operations, blood station, and radiologic service. With clear next steps and a shared vision, we're set to make real progress. Let's move forward together. As we conclude our gathering today, we would like to extend our heartfelt gratitude to all of you for your presence and participation. Your support means the world to us at Iranon District Hospital. We would especially like to recognize and express our deepest appreciation to Honorable MP Ubaida C. Pacasem. Your unwavering initiative and commitment to improving healthcare in our community have made a significant impact on the Iranon District Hospital. Your advocacy and support have empowered us to enhance the quality of care we provide to our patients and to better serve the needs of our community. Thank you once again for your contributions and for joining us today. Together, we are making a difference in the lives of many, and we look forward to continue this journey with all of you. Thank you everyone for listening. Sa IDH, tunay kang iingatan.